Minister Dr Zweli Mkhize and the National Coronavirus Command Council will meet today to discuss the country's response to the COVID-19 pandemic. The Minister joins us now via our video link. Minister Mkhize, thanks very much for your time on Channel 405. We are seeing, Minister, a drop in COVID-19 infections. There is also, on the other side of that, an argument that we are perhaps testing less. Is that a valid argument, or can we take this as a positive sign that we're seeing a drop in infections?
It's a very promising sign. It's promising because the numbers that we are seeing over the past few months, we have seen the numbers rise to a very high level. They have now started declining in all the provinces. I've been to inspect KwaZulu-Natal. It's not only the numbers of tests, but it's also the pressure they're feeling in the wards that the numbers are coming down. There are enough test kits, but because the testing was focused on those who had symptoms coming to the hospitals, those numbers have suddenly declined because the surge is slowly easing off. And therefore, we are quite comfortable that we've got enough kits to be able to do as many tests as we've been doing. We've also cleared a number of backlog specimens which were lying in the fridges in many provinces, and that has been reduced to a point where for every province we now have 24 hours waiting period for patients. At the most it can be 48 hours. So we actually are comfortable with the progress at this point.
But I suppose, Minister, you would not want to tell South Africans that we can now relax. You would still want, in order for us to continue with this downward trend in infections, it's important for us to again emphasize, as I'm sure you will do, that we continue with those non-pharmaceutical interventions.
You are quite right. Actually, the reason why we're seeing the pandemic behaving like this is to a large extent from the behavior of those who are observing non-pharmaceutical interventions of using masks, hand washing, sanitizers, cough etiquette, and keeping distance. Those are the people who have helped us to get to the inflection point of this infection. That's the only thing you can explain. And beyond that, the fact that we have not reached the zero transmission is because there are many, many more who are not using hand sanitizers and masks. We are therefore saying, in order for us to defeat this pandemic, we need everybody to use masks when they get out of their house, when they get to the public places. We need everybody to wash their hands. So that for us is the message that there's a risk that we might actually never get to the bottom where we've got zero transmission because there are many people who continue to spread the infection. There's also a risk that we can have a resurgence in the next few weeks. If people just ease off and forget about everything, we have to be very, very strict with the containment measures.
Right. Minister, there's also been questions being asked about the country's overall mortality rate, even outside the pandemic. Trends in some instances are showing that a whole lot more people are dying generally during this period than perhaps this time last year. And there have been questions raised about whether or not we're missing what is being called excess deaths, essentially unaccounted for COVID-19 related fatalities. How much attention is this particular issue receiving from the ministry?
Actually, you might find this a bit complex. For most of the time, we actually had fewer deaths during this time than we did the previous year because of the reduction in the trauma-related accidents, and the restrictions on alcohol did give us a drop in some of those unnatural deaths. At the same time, we've also not seen the flu that we normally would have seen. However, a modeling was done to say even if you take those into account, there are numbers that are accounting for the fact that we may be having unrecorded, undiagnosed COVID-related deaths, and at the same time we may have other deaths that might be due to the fact that people might be staying away from hospitals, either for fear of the infection or for the fear that they may not be able to get space because there's a COVID pandemic. So these we are calculating. Our mortality numbers are within the figure of 1.8 or so. That's still very low, but the excess deaths is something that's happening in all the countries, and ours are no much worse. But we're wanting to do post-mortem swaps to be able to reduce the numbers of COVID-related deaths that are not recorded.
Statistics that we will still understand better in the weeks, months ahead. You mentioned now, Minister, in trying to explain to us the excess deaths issue, that there were fewer deaths as a result of unnatural causes. But these excess deaths here, I'm reading one article here that talks about a 59% increase in natural deaths during one period of July this year. Can you just continue to explain that issue for us, Minister?
Yes. The total numbers of deaths when we had restricted alcohol had reduced quite significantly. But when we were then modeling, the numbers of excess deaths comes from that kind of modeling. That begins to take into account that there may be deaths that are not immediately captured as COVID-19 related deaths. So those deaths are part of a modeling that is to try and track how many more people could be then dying as a result of undiagnosed COVID-19, how many people could be dying also as a result of not accessing health services. Now, during the days of the lockdown, we had discharged a lot of patients, and we had also a lot of people who were given script to treat themselves at home so that they don't have to come back to hospital. So we saw in some areas at the beginning where the numbers of people who were coming for immunization and other treatment was declining. So we have to keep track that to see how many more people could be dying at home. So that's how the calculation was done. What should have been the number the previous years? And if you take out the problems of the reduction due to unnatural causes and possibly the low level of influenza, all of that gave us the numbers that you are referring to. So it's a calculation that has to be done in line with what's happening in the rest of the world. But it is not necessarily a failure of the system. It's more the nature of the COVID-19 that does that in all the countries.
Right. So, Minister, can we then say with a fair amount of confidence that the death toll we've been reporting all this time is probably higher than the figures that we're getting from the ministry?
No. Well, there may well be more people who would have died. No one knows how many people could have died from COVID-related symptoms and how many would have died from natural causes, because such a study has not been done. That's the reason we are now doing post-mortem swaps, just to try and separate out, because because every day someone would be suffering from one problem or another. So that still is happening. And so the numbers, no one really knows. Even if we say it's excess deaths, we say it's in the environment of COVID-19, but not all of them are due to COVID-19. So we have to now try and track to see whether we can find more about how many are actually COVID-related. The numbers would be a bit higher, but it's not an unusual calculation if you compare with what's happening in the rest of the world.
Minister, can we shift gears, and can you give us a snapshot of our hospitals at the moment and our capacity to take in COVID-positive patients? I also want to talk to you again about the issue of 67-year-old Sibusiso Khumalo, the man who died in that parking lot at Northdale Hospital, where a makeshift so-called fever clinic had been set up in that parking lot, Minister. Can you touch on that issue and whether fever clinics are part of the ministry's way of dealing with COVID cases as a triage, and then also talk to us about our hospital capacity?
Well, thank you very much. Let me say that in the past month, up to 2 weeks ago, almost all the provinces, particularly Eastern Cape, Eastern Cape, Gauteng, KwaZulu-Natal, and the other provinces have been feeling an increasing number of patients. At some point where Gauteng was almost full at the point of the admission was, that was because the observation was where you keep people under investigation was moving slowly due to the slow return of results. So as we speak now, the hospitals are not full. We've moved all the patients out. We reduced the turnaround time, so there's no delay at outpatients at the point of separating the patients from positive to negative. Now, all the provinces don't have their hospitals full. The city ICC is not full. Newzroom is not full. Pixuga Isaga Seme in Tegwin is not full. VW, all of these beds are actually not fully occupied, yet the numbers are beginning to reduce across the whole country. In the case of the Northdale Hospital in KwaZulu-Natal, it is unfortunate that we lost the patient. However, the loss of the patient tends to be related to the severity of the illness. The problem we had was that they had a KB clinic, fever clinic, which was not well structured according to the specifications of the department. That was why we took action. We've gone into the area. We've got the action taken on those in management who have neglected to prepare the hospital appropriately. We've also set up the proper structures in place now. I can just say that it was regrettable that somebody died under those circumstances. However, we think that is the severity of the condition that would have brought us that unfortunate situation. But action has to be taken when we think management is not behaving up to the expected level to provide quality of care.